Did you know that after suffering a stroke, your doctor might prescribe you some medications that you were not prescribed before? This is because when you have a stroke, there can be many factors that go into the stroke diagnosis. Now, depending on how your doctor feels, they may or may not prescribe you some new medications. But if they do, these are a couple of medication classes you could expect to receive. So, commonly, when patients have strokes, they usually get anti-seizure medication. This is to protect you against future seizures or potential seizures that the stroke might have damaged that part of the brain. Now, when you take seizure medication, it is very important to do so on a schedule. Why? Because that seizure medications needs to maintain a certain level in your bloodstream. If you don't maintain a certain level in your bloodstream and it drops, you will no longer be protected against seizures. Now, of course, you still are at risk for seizures on seizure medication, what we call breakthrough seizures, but that incidence is a little bit less than without this medication. Okay. Another class of medications that you might be prescribed after a stroke would be anti-diabetics, something for blood sugar. Why is this? Well, when you have a high blood sugar, it damages your blood vessels. It can do a number of things. And they would want not to be a risk factor. So you could expect to be prescribed maybe a metformin is a common medication that many people get prescribed when they are initially diagnosed with type 2 diabetes or post-stroke. Now, remember, a side effect from metformin, which is very common, is GI upset. So just make sure you educate on that as well. Another medication class that you might get prescribed after having a stroke or experiencing stroke is cholesterol medication to bring cholesterol down. Okay, that's also a risk factor for strokes. Now, the last medication that you may or may not be prescribed is aspirin, a low dose aspirin, kind of like what we call a baby aspirin. The dosage would be 81 milligrams. It could either be a chewable or it could be an extended coated release tablet, but that is another common medication that you might be prescribed, okay? And this is for heart health. It does thin the blood. It does have antiplatelet factors in it so that you don't risk another blood clot going into your brain or possibly into your heart. So those are some common medications that you might get after you have a stroke. All of this is dependent on your doctor. Talk to your doctor about this. Ask as many questions as you can. Remember, knowledge is power. The more that you know, the more that you can advocate for yourself. Okay? Ask about side effects. Ask about how common they are. And always take advice from your medical doctor and not Google or ChatGPT. This has been your mini nursing minute. We'll see you soon again. Thanks, guys. And remember, this does not substitute medical advice. This is education and informational purposes only. Always refer to your physician or your medical team for more information.